Hi and welcome to our telehealth information video. I'm Garvin and this video is on Evra Patches. So what is Evra Patch? Evra is a transdermal patch that continuously releases two hormones, an estrogen and a progesterone, that are absorbed through your skin into your bloodstream and work like the pill. You wear one patch a week for 3 weeks, followed by a week off. So Evra is used for preventing an unwanted pregnancy, so contraception or birth control. Evra is most often prescribed for young women who don't have any major health issues. It's not suitable for women who have an increased risk of getting a blood clot, including women over 35 who smoke. Evra is more than 99% effective when used correctly. It's not affected by vomiting or diarrhea, but can be affected by some medicines. It's less effective in women who weigh over 90 kgs. Evra patch won't protect you against sexually transmitted infections. The most common side effects include headache, feeling sick, breast tenderness and mood changes. Breakthrough bleeding, spotting and missed periods can be common in the first few months, so see your doctor if this persists. If you don't have a period for 2 consecutive months, do a pregnancy test before applying a new patch. Blood clots are a rare but serious side effect of Evra. How does Evra patch work? So Evra patches contain 2 ingredients, ethinyl estradiol and norogestarenone. These are synthetic versions of the naturally occurring female sex hormones estrogen and progesterone. The hormones in Evra are similar to the hormones used in the contraceptive pill and work in the same way. They override your natural menstrual cycle and work mainly by stopping the ovaries from releasing an egg each month. They also increase the thickness of the natural mucus at the neck of the womb, making it more difficult for sperm to cross from the vagina into the womb, as well as thinning the womb lining, making it more difficult for any successfully fertilized eggs to implant there. You apply one patch once a week for 3 weeks, and then you have a week off. During your patch-free week, the levels of hormones in your blood fall and you usually get a withdrawal bleed that's like your period. The contraceptive patch is not suitable for all women. You shouldn't use it if you're over 35 and you smoke, or you stopped smoking less than a year ago, or are very overweight, a BMI more than 35, if you've ever had a blood clot in your leg or lungs, and if you ever had a heart attack, angina, stroke or mini stroke, have a very high blood pressure or vascular disease. So can you use the patch if you're breastfeeding? Evra is not the preferred method of contraception for women who are breastfeeding, because the estrogen in it reduces the amount of breast milk you produce. If you do decide you want to use it, you shouldn't start until at least 6 weeks after the birth, when breastfeeding is fully established. So, how do you use Evra patches? You apply one patch once a week on the same day each week for 3 weeks. You then have a week without wearing a patch. During this week, you usually get a withdrawal bleed that's similar to your period. Apply a new patch after 7 days, even if you haven't stopped bleeding. You'll still be protected against pregnancy in your patch-free week, provided you use the previous 3 patches correctly. You start the next cycle of patches on time and nothing else happened that could make the patch less effective. For example, taking other medicines or certain medicines that could interact with it. You follow the instructions in the leaflet provided with your patches carefully. Only one patch should be applied at a time, and do not cut the patches. Apply each patch to a clean, dry, hairless, intact, healthy area of skin on the buttock, abdomen, upper outer arm or upper torso, in a place where it won't be rubbed by tight clothing. Do not apply it to your breasts or to the skin if the skin is red, irritated or broken. When you change the patch, remove the old patch and replace it with a new one in a slightly different area to avoid irritating the skin. Don't apply makeup, creams, lotions, powders or other products to the area of skin where you're going to stick a new patch, as they can stop it sticking properly. Don't use extra adhesive or bandages to hold your patch in place. If a patch has stopped sticking before a week is up, replace it with a new one. Do not flush used patches down the toilet. Dispose of them in a bin in the sachet provided. So when can you start using the patch? Check with your doctor, because this depends on personal circumstances, such as if you're changing from another form of contraception, or if you're starting it after having a baby, or following a miscarriage or abortion. Your doctor will also advise on how soon you'll be protected against pregnancy. For some women, this will be as soon as they apply their first patch, but most women need to use condoms until they have worn a patch for 7 days. So what if the patch comes off? Check your patch daily to make sure it is still attached. If it comes off partially or fully for less than 48 hours and is still sticky, reapply it to the same place. If it has lost its stick, replace it with a new patch immediately. You don't need to use extra contraception if the patch was correctly for 7 days before it came off. Change the patch as usual on your usual change day. If the patch comes off partially or fully for more than 48 hours, or you don't know when it came off, you may not be protected. Start a new patch cycle by applying a new patch straight away and use extra contraception for 7 days. Change the new patch after 7 days. You may now have a new patch change day. If you have unprotected sex in the week before your patch fell off, get advice about whether you need emergency contraception. So what if you forget to apply a patch? If you forget to change your patch on your usual change day, change it as soon as you remember, then carry on as before. You may now have a new patch change day. If you apply the new patch less than 48 hours and you wore the previous patch correctly for a week, you don't need to use extra contraception. If you apply the new patch more than 48 hours late, you will not be protected against pregnancy. So use extra contraception for the next 7 days. So what are the potential side effects of Evra Patches? Common side effects include headache, feeling sick, abdominal pain, breast pain or tenderness, slight bleeding or spotting between periods in the first few months, lighter periods or sometimes stopping of periods, mood change. However, there's no evidence that the patch causes depression. Skin irritation or itching where you apply the patch. And the risk of blood clots is also increased if you're travelling for long periods of time where you will be sat still, particularly flights over 3 hours. So ask your doctor or pharmacist for advice on using travel stockings and calf exercises or aspirin if you're going on a long haul flight. Can you use other medicines with Evra Patches? If you regularly take any of the following medicines, the patch probably won't work for you. So you'll need to use a different form of contraception. Certain anti-epileptic medicines such as carbamazepine, some medicines for HIV such as ritinovar, the antifungal grisofulvin, modafinil, the antibiotics rifabutin or rifampicin for tuberculosis, the herbal remedy St. John's wort. So if you're prescribed a short course up to 2 months of any of these medicines, this can also make the patch less effective, and your doctor will usually recommend that you temporarily use a different form of contraception. While you're using Evra, it's a good idea to check with your doctor or pharmacist before you take any other medicines. But some key points to remember are antibiotics, other than rifampicin, won't make Evra less effective, and it's fine to take a course of antibiotics. You don't need to use extra contraception. If you need to take emergency contraception while using Evra patch, for example because you're late applying a patch, be aware that the Ella 1 brand, which contains olapristol, can make Evra less effective. If you take this type of emergency contraception while using Evra Patch, you should use extra contraception, such as condoms, for 14 days after taking it. So that brings this telehealth video to an end. If you have any questions, you can leave them in the comments below or contact me through my website, mytelehealth.info, or call into us at Lynch's Pharmacy, Douglas, Cork, or you can ring us on 021 436 6923 to find out more. Thank you for watching. Stay healthy and stay informed.